Welcome to this short video on studying clinical psychology at HKU. I'm Dr. Francis JIN, an assistant professor in clinical psychology. In this video, I will give you a brief overview of studying clinical psychology at our program. Clinical psychology is both an academic research field as well as an applied profession. At HKU, our clinical psychology faculty members conduct active research that covers a wide range of mental health-related topics and provide trainings for the next generation clinical psychology practitioners in Hong Kong. Next, please allow me to give you a brief introduction about what kinds of knowledge and information you may gain from joining us. Clinical psychology as a field is primarily concerned with mental health problems. So what are some examples of mental health problems? The first thing comes into your mind, perhaps, is stress. Indeed, many of us conduct research on how people handle life stressors. One major theme in our clinical practice is to help people to better cope with life stressors. Anxiety and depression are some of the common mental health problems associated with stress. Relatedly, difficulties in daily routines such as sleep problems, concentration and attention problems, or having a hard time in social life are also subjects within the scope of clinical psychology study. Finally, problems like hallucinations and delusions are also among the matters we care about. At HKU, clinical psychology research labs led by our faculty members conduct active research on various topics, covering both psychopathology and intervention. Research on psychopathology aims at better understanding the nature of mental health problems. For instance, one of the most fundamental questions is what phenomena should be considered as mental disorder, and how should we define and classify different types of mental disorders. We also study how we decide whether a person is suffering from clinical depression or anxiety, and how can we identify people who are at risk of developing schizophrenia. This type of research often requires scientists to collect data from thousands of people and use statistical tools to find the answer. Another type of psychopathology research is to answer what causes and maintains a mental health problem. The modern view of many mental disorders is that multiple factors contribute to the problem. For example, to answer what makes people more likely to be depressed, we study genes, brain, physiologies, behaviors, thinking patterns, and personalities. We also study family environment, social relationships, and other life stressors. By studying how these various factors interact, we hope to gain a better understanding of the etiology of mental disorders. Besides figuring out what causes problems, clinical psychology scientists also conduct research on developing better intervention programs at various levels. Some intervention research targets on helping people to conquer specific disorders, such as treatments for phobia. Some intervention research helps people resolve specific issues, such as how to improve sleep quality. By doing so, researchers help generate applicable knowledge to improve the well-being of people who may suffer from these problems. Furthermore, intervention has a much broader scope than just the treatments. Given that mental health issues typically involve the household, community, and even society, research teams at our department also study how to implement programs in the community so that we can intervene at an earlier stage, even before the problem gets too severe. The other important component of our training is on clinical practice. The clinical psychology area provides professional training programs for clinicians in Hong Kong. Clinical psychologists in the field apply our knowledge on psychopathology and interventions to directly help people improve their quality of life. Clinical psychologists conduct assessment to figure out what the problem the person is experiencing and what are the possible causes, based on which treatment programs are recommended. Clinicians also provide interventions to directly help the individual in need. For example, many times we can help people feel better by helping them to change the way they think and the way they behave. To achieve such goals, we often work together with other health professionals, such as educational psychologists, social workers, and medical doctors to help improve people's well-being. If you are interested in getting more information about our programs, please check out our website.